Hey VPG family, this is Dr. Mumbauer. As we hear discussions about how to move forward after a month and a half of social distancing and sheltering in place, we've been thinking a lot about well visits, immunizations, and preventive care for your kids. Now, we don't have any way to predict what will happen with the coronavirus pandemic. We don't know when it will be over. However, the experts whose opinions we value the most feel COVID-19 is probably not going to go away anytime soon. It's likely going to change. It may decrease some over the summer and then start to come back more in the fall. And we'll learn better ways of managing our risks for COVID-19. But it's probably not going to go away, at least until we have an effective vaccine, and that may take a year or more. So that brings me back to well checks. Well visits and preventive care and continuing to keep our kids up to date on their vaccines are all really important for maintaining ongoing health and well-being of our children. As we move into whatever our new normal is, we think it's time to resume seeing older kids and to continue to see infants and younger kids for their well visits. In fact, we're putting a big effort into contacting parents to schedule well visits for kids who are due for a well check. Now, maybe you've gotten a phone call from us or a letter about this. It's still really important, though, that we provide those well visits in a safe environment. So we're continuing to adapt our office procedures and our scheduling to try to keep everyone as safe as possible. We've started only scheduling sick visits in the afternoons and now only in one office. We'll alternate offices for sick visits so that one day sick visits will be seen in our Verona office and the next day in Waynesboro. As always, if your child is sick, we'll see them in either office regardless of which office you usually use. And of course, we'll continue to offer telemedicine visits throughout the day. Now, taking this approach means that one office will be limited to well visits all day long, while the other office only sees sick visits in the afternoon. But that gives us lots of time for well visits. But this approach should also significantly decrease the risk of any inadvertent exposures to any child who is sick with COVID-19. In the meantime, we're also continuing our efforts to keep you safe in the office by using enhanced cleanings throughout the day, by eliminating waiting in our waiting rooms, by wearing masks continuously, we're washing our hands frequently, and you'll see the doctors continuously cleaning our instruments in between each patient. We think that well checks and preventive medicine are among the most important services that we as pediatricians provide. We're ready to fully resume this very important service and really encourage you to call to schedule your child's next well check if he or she does not already have one scheduled. Now, stay safe and call us if there's any way we can be of help to you. We're happy to continue to provide well care and keep your child up to date on their immunizations so that we don't deal with other infectious diseases coming back while we're dealing with the coronavirus epidemic. Be careful, stay safe, we'll be in touch.